Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Fight against climate misinformation. Let medical professionals take the lead. Medical professionals have a responsibility to lead the fight against climate misinformation to ensure that the public is well informed about the health risks posed by climate change, says expert in the BMJ. Misinformation and disinformation in health is not new, write Professor Andy Hines and colleagues. Just as the rapid spread of false information during the COVID-19 pandemic undermined public trust in science and public health interventions, false information also pervades the climate change debate, influencing public perception and policy. The World Health Organization has identified climate change as the greatest threat to global health in the 21st century, but the public's understanding of this threat is often clouded by conflicting narratives. Effects of extreme rainfall on mortality rates, BMG study highlights. Extreme rainfall events are associated with an increased risk of death from all causes as well as from heart and lung diseases, finds an analysis of data from 34 countries and regions published by the BMJ. The health effects of extreme rainfall varied by local climate and vegetation coverage, providing a global perspective on the effect of extreme rainfall events on health. Climate change is intensifying the frequency and severity of short-term rainfall events, and emerging evidence suggests a compelling link between rainfall events and adverse health outcomes, particularly transmission of infectious diseases. But the influence of rainfall events on cardiovascular and respiratory health and how varying rainfall intensities affect these conditions remains understudied. To address this, researchers set out to examine the association between daily rainfall and all-cause cardiovascular and respiratory deaths. They analyzed daily mortality records and rainfall data from 645 locations across 34 countries or regions on 6 continents, comprising a total of 10,99,54,744 all-cause, 3,11,64,161 cardiovascular and 1,18,17,278 respiratory deaths from 1980 to 2020. The main measure of interest was the association between daily deaths and rainfall events with return periods of 1 year, 2 years and 5 years. Factors that might affect this association such as local climate type, rainfall variability and vegetation coverage were also taken into account. During the study period, a total of 50,913 rainfall events with a 1-year return period, 8,362 events with a 2-year return period, and 3,301 events with a 5-year return period were identified. Increased coffee consumption may boost vascular health in lupus patients. New research indicates that caffeine consumption may boost vascular health by supporting the regeneration of blood vessel linings. The investigation conducted by Italian scientists on lupus patients highlights caffeine's potential benefits for those at increased risk of vascular diseases due to inflammatory conditions. A new study published in Rheumatology by Oxford University Press suggests that increased caffeine intake could improve heart health. Until now, doctors' recommendations to reduce the vascular risks were essentially about avoiding risk factors. This included stopping inflammation, decreasing cortisone medications, as well as conventional recommendations like not smoking, reducing cholesterol, and controlling high blood pressure. The researchers from Sapienza University of Rome in Italy involved in this study believe patients may be able to improve vascular health by doing something that's actually enjoyable. The laboratory results of these investigators suggest that caffeine present in coffee, tea and cocoa actively helps endothelial progenitor cells, the group of cells that help regenerate the lining of blood vessels and are involved in vascular growth. Calorie restriction may have greater impact on lifespan than periodic fasting. For nearly a century, laboratory studies have shown consistent results. Eat less food or eat less often and an animal will live longer. But scientists have struggled to understand why these kinds of restrictive diets work to extend lifespan and how to best implement them in humans. In the current study of Nature, scientists at the Jackson Laboratory and collaborators tracked the health of nearly 1,000 mice on a variety of diets to make new inroads into these questions. The study was designed to ensure that each mouse has genetically distinct, which allowed the team to better represent the genetic diversity of the human population. By doing so, the results were made more clinically relevant, elevating the study to one of the most significant investigations into aging and lifespan to date. The study concluded that eating fewer calories had a greater impact on lifespan than periodic fasting, revealing that very low-calorie diets generally extended the mice lifespan regardless of their body fat or glucose level, both typically seen as markers of metabolic health and aging. Surprisingly, the mice that lived the longest on the restrictive diets were those that lost the least weight despite eating less. Animals that lost the most weight on these diets tended to have low energy, compromised immune and reproductive systems, and shorter lives. Our study really points to the importance of resilience, said Gary Churchill, Carl Gunnar Johnson Chair and professor at JAX who led the study. The most robust animals keep their weight on even in the face of stress and calorie restriction, and they are the ones who live the longest. It also suggests that a more moderate level of calorie restriction might be the way to balance long-term health and lifespan. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.